My name is Peter Fitzgibbons. I'm an orthopedic hand surgeon here at the hospital center. I went to medical school at Dartmouth and Brown in a combined med school program and did residency at Brown University in orthopedics. The hands have this incredible number of tendons and bones and nerves and move in this incredible number of ways. And so the challenge of understanding all that, putting it all together, particularly when there are problems, and trying to figure out how to fix them is really fun and challenging. I can think of a couple incidents of car accidents where, and this is sort of unique to the hand, where people have ended up with this combination of injuries where they have fractures of their bones, they have tendon injuries, and they have nerve injuries, all of which have to be addressed separately. But at the same time, they interact with each other, and for each one of those, you have to think about the other when you're actually fixing them, and then when you're figuring out how this person is going to rehab from the injury, which is, probably 75% of what's going to determine their outcome. And so having the perspective, I think, to figure those things out together is really important. Acute injuries is probably the number one thing. Beyond that, tendinitis, nerve problems, and arthritis in the hand are probably the most common. I did 2 fellowships after residency. So I did a fellowship in orthopedic trauma surgery, and then another fellowship in hand and upper extremity surgery. So I think that's relatively unusual, and I think it gives me a pretty broad and in-depth perspective on a whole variety of injuries. And I can sort of think about things from different perspectives. And